So this is actually something I know a lot about. I know I've mentioned this a few times. One, plastic surgeons are kind of the end-all be-all of wound care. Also, I've been director of huge wound care programs for I think going on 12 years now. The last 6 or 7 years I've been at Horizon Medical Center, which I'm very, very proud of. It's arguably the best wound care center in the entire Metroplex. I honestly believe that. We just have like such a great wound care program. So I see lots of wounds, and every once in a while we'll do a case. I think last week we did, or 2 weeks ago we did the sternal wound, and we did a dog bite. So I want to talk about hospital-acquired wounds. That's actually my center. That's Horizon Medical Center up in the North Metroplex. Great little facility, LTAC, inpatient, outpatient, great place.
Nice.
Yep. So I want to talk about hospital-acquired wounds, and this is not just me yammering about wounds to hear myself talk. Like there is like my daughter uses that yammering. She loves that word. There is a purpose for this, because I feel like if patients are educated about what kind of wounds that they, or more likely their family member, like an older family member, could get, and they know the risk factors, that they could potentially prevent a wound from happening. Okay. And there are definitely downsides to people getting these wounds. So this is going to blow your mind. The estimated cost to healthcare. Okay, I'm going to ask you guys. I never quiz you guys anymore. I don't want to put you on the spot. No one's going to know this, but I'm just going to have you guys throw out a number for how much money does it cost the United States healthcare systems for wounds acquired in a facility, whether it be a hospital, LTAC, nursing home, in dollars every year. Who wants to go first?
I'll go
Travis.
first.
Okay, Travis. Yeah, throw me a number out there.
So like a yearly number?
A yearly number. This is the extra cost that's added to our healthcare system every year because of the wounds that we're going to talk about.
I'll say 10 million.
10 million.
That's a big number.
It is a big number.
I don't even know. Like
shooting in the dark.
10.1 million.
Try 30 billion with a B. 30
Gross.
billion dollars. Okay, to put that number in perspective, the healthcare expenditure in the United States every year is around $4 trillion. That means that these wounds equate to between 0.5 and 1% of the total expenditure of healthcare in the United States. Now I know 1% is not a big number, but think about how much goes into healthcare. Doctors' salaries, nurses' salaries, hospitals, drugs, surgeries, clinics, nursing homes. I mean, everything, all of that, and this is like about a little less than 1% of it that these wounds. So it is a big problem. I mean, this is not a joke.
Yeah, now I want to know which ones they are so I can
Cool, I'm glad you're excited. So
make
good.
sure we don't get none of that.
Yeah, you don't want to get these. So as I said, the reason I'm doing this is because I want to educate people what they are to potentially prevent them. And I say this because these wounds can develop very quickly in the hospital. And once they develop, they can be extremely hard to get rid of. I have patients in my clinic. I have a huge wound clinic. I mean, I see, on average, I have 30 to 50 patients with wounds that I'm seeing. I don't see each one every week, but I see tons of patients with wounds. And some of them, the more difficult ones, I've had patients that have had wounds for a year, that they didn't want to have surgery, because I can always go fall back on surgery. But for some patients, either surgery is not an option, maybe they're too sick, or they just don't want to have it. Some of these wounds can take a year to heal. So I want to go through what they are. And have you ever heard that the saying, an ounce of prevention is worth a pound of cure?
Yeah.
That goes triple for these hospital wounds, triple. Okay, so I want to go through the different types first. I'm going to list them out, and then I'm going to go through each one in detail. All right, I'm putting you guys on the spot. Can you guys name, there's a list here, one type of wound someone might get in the hospital?
Those like bed sores.
Bam, Sarah nailed it. Sorry, Travis, she took the easy answer.
It's okay. It's all right. She knocked it out of the park. I'm proud of you.
She knocked it out of the park. What do you think? Can you name one?
That you get in the hospital?
Anything.
I have no clue.
Oh, that's cool. It doesn't matter. I just wondered if you guys, does the average person...
What about like bruises? Like bruises
Yes,
from...
trauma, right?
Yeah, right, all right. Bruises.
There you go, trauma. That's another one. Okay, excellent. So you guys are all on top of this. Okay, so the different types of wounds, decubitus or pressure ulcers, so that's a bed sore. So decubitus ulcers, pressure ulcers, and bed sores are all the same thing.
Okay.
The doctor words decubitus Pressure sore is kind of the description. Bed sore is like the generic term.
Okay.
Surgical site infections. So someone has surgery and they
Right.
get an infection and that makes a wound. Edema wounds. So I'm going to break down what that means. But these are wounds related to having a lot of swelling. IV infiltration wounds. So when people have an IV that goes bad. Non-surgical infections. Okay. So when you have an infection that gets so bad that creates a wound. Remember we talked about necrotizing fasciitis?
Yes.
So that'd be a non-surgical infection wound. That's actually some of the worst wounds you can see. Travis hit it, trauma, that's another one. And then lastly would be wounds from medical devices. All right, let's talk about the risk factors, okay? So I know you guys probably hate me. Can you guys name one risk factor for why you might get a wound in the hospital? I know you're not medical, I'm just,
A risk factor?
yeah, like,
Procedure issues.
bam, you had a procedure. There you go. That's a good one. You had a procedure, right? If you have surgery, you have an incision, then you can get a wound.
Yeah.
Yeah, that's good. Travis, you want to stab in the dark?
I have no clue.
Okay, all right, very good.
I'm gonna bow out.
It's okay, man. I know I'm asking you guys medical topics. It's just always fun to see, I mean, you guys are smart. I feel like you guys know more about medicine than the average cat on the street. Like,
Absolutely.
you guys are good.
Sarah knocks like a lot of the questions out of the park.
Dude, I'll be sitting here and I'll be like, she'll just say something like, damn, Sarah, good job.
I have no
I feel like
clue.
she's absorbing all this information. It's like, it's
Absolutely.
osmosis. Okay, so risk factors. Immobility, right? So say you're
The
in a...
bed sores.
Right, bed sores, right. So you're in a trauma, or maybe you've had a heart attack and you're in the ICU, and maybe you're on a breathing machine and they're giving you medications, you're not moving. Immobility. Next, chronic medical conditions. We always talk about diabetes when we talk about risks. Diabetics are much more prone to get wounds, as are people that have things like, blood vessel issues where their blood flow is not as good.
Right.
Older patients, as you get older, your skin gets more fragile, your tissues get more fragile. It's much easier for you to develop wounds. Malnutrition, right? People who are malnourished, much more prone to wounds. Smoking, smoking's not good for you. Just by the way,
That's why they can't advertise.
that's why they can't advertise. Obesity, people that are heavier, more prone to wounds. Immunosuppression, so that's somebody that might be on certain drugs that are suppressing their immune system.
Okay.
Certain medications, things like steroids, which, that falls into immune suppression. Surgical procedures, like you said. Incontinence is huge. If people are incontinent, much more prone to wounds. I'm going to talk about that in a minute. And the reason that, it's so important, number one, these wounds are hard to get rid of, but two, it's been shown clearly that when patients get wounds in hospitals, it increases morbidity. So morbidity is just a word that doctors throw around, which means bad things, like, getting back to normal life or pain or whatever. And then mortality, meaning death. So these are reasons why you would definitely want to prevent a loved one from having one of these. Okay, so I'm going to talk most about two things because they're the big ones. So you said it, Sarah, bed sores, also called decubitus wounds. So we said that all wounds in the United States cost us 30 billion with a B. Decubitus wounds accounts for 25 billion of that. So it is far and away the biggest type of wound that people get in the hospital. There are 4 really common areas that people get these wounds. Sacrum, which is the area kind of in between your buttocks muscles.
Yeah.
All right. Ischium, which is what we sit on. It's called the ischial bone is the bone that we sit on. And of course, there's fat tissue and muscle underneath it. The hips is the other one, and the heels. And also, and this is kind of getting kind of a deeper dive into the pathophysiology about this. Those pressure points do come along with certain positions. So for example, if I was to sit in this chair for a year, which I wouldn't do, I would get wounds on my ischiums because that's where the pressure is, but I wouldn't get it on my sacrum because there's no pressure on my sacrum. When the sacrum gets pressure is when you're lying flat in bed on your back.
Yeah.
Then you get pressure on your heels and you get pressure on your sacrum. When you're lying on your side, you get pressure on your hips. Why am I telling you this? Well, if you have a patient or a family member in the hospital and they're staying in one position, then they're going to be at risk for getting wounds in those locations.
Yeah.
And it's common sense, right? When you're laying flat on your back, like you're on your buttocks, which is your sacrum, and you're on your heels. The back of your head's kind of an honorable mention. Sometimes people will get wounds on the back there. So what are the risks of decubitus wounds specifically? Pressure's number one. What we do for our patients, especially when they're immobile, is we, are we good? Are we good, Travis?
We are.
Okay, just checking. The monitor went dead. We make sure that we rotate patients because we don't want them to have pressure in the same location for long periods of time because that's what causes these wounds to develop. And so you might say, okay, what is about the pressure? Well, when you have pressure in one location for long periods of time, it actually inhibits the blood flow. And so what it does, it basically strangulates the life out of those tissues, and the tissues die, and then the wounds develop. Immobility is the big one too, pressure, immobility, incontinence. Man, this is such a huge one. When patients are in the ICU, oftentimes, they'll have a catheter in, but the stool, they poop on themselves. And if it's not caught quickly, that stool sitting on the skin can cause a wound so fast. And this is one where patients' families can really be helpful, because if they realize that their family member who might be sick has an issue with incontinence, then they need to alert somebody right away, because that's one of the things that can cause these wounds to develop. The extremes in weight's a big one. So when people are really heavy, like obese, then they have added pressure. But the flip side is if you're really skinny, then your bones are pointier. And so you'll see malnourished patients get wounds really quickly, because they're thin, they don't have that cushion, and so that pressure point causes a wound. Advanced age, also older patients who are ill, smokers, and then also the surface. I use that one, like for example, if somebody was maybe maybe a patient that's in a nursing home and they're sitting in a chair that's maybe like a rocking chair that's hard wood. Bad idea. Right. You want to have a nice cushion, and especially people who are at risk, you want to have specialty cushions for them to sit on, because these wounds can develop very quickly. As far as treatment, I'm not going to do a dive into the treatment of these. That would be a separate talk. Treatment of these is very multifaceted. There's wound care, surgery, all kinds of things you could do. So after decubitus wounds, the biggest next wound that people can develop is surgical infections. Right. So 2 to 5% of surgeries result in infection. Now, you have to take that number with a grain of salt, because it really depends on the type of surgery you're doing. For the surgeries I do, young, healthy people doing elective, superficial surgeries, infection rates should be way less than 1%. And it is. Like for example, breast augmentation, literally in 14 years of doing these, I've had one infection. I mean, this is like hundreds of cases. But it's because I'm doing a simpler surgery. I mean, it's artistic, but otherwise rather simple on a healthy patient. Surgeries that carry more risk are things like intra-abdominal surgery, GYN surgery, where these are considered more contaminated cases, orthopedic surgeries, and then trauma. Right. When you calculate those have a higher rate. So the average falls into
surgeries.
What's that?
I've had 2 of those surgeries.
GYN.
Or is GYN that's just what is that?
Like a C-section.
Okay, yes. Yeah. I've had a C-section, and I broke my arm when I was a kid.
Okay, yeah, orthopedic. Did you heal okay?
Yeah, I had like pins in my arms and everything.
Yeah, I'll tell you what really common in intra-hospital wound is C-section infections, because they're considered dirty cases, because of the, opening the uterus, and, there might be, they call it meconium when the baby, has a bowel movement in the placenta, and so that gets in the wound. So those are considered dirty cases. So yeah, that's a high one. But the cost of surgical infections, $3 to $4 billion. So right there you see where most of the money comes from with wounds, is either decubitus wounds or bed sores, and then surgical infections. So for every surgical infection, it increases a hospital stay about 10 days. Okay. That's a lot. And increases the cost of stay by about $20,000. Yeah. That's a big number. It does increase. Huh?
So it's serious.
Yeah, it's serious stuff. It increases the morbidity and the mortality. So what are your risk factors for getting wound infections? Well, we talked about the type of surgery is important. If you have a loved one that's in a trauma surgery, orthopedic surgery, abdominal surgery, GYN, those are ones a little bit more concerning. If your patient has the illnesses like diabetes, if they're obese, that's a big one. The thicker that tissue is that you have to cut through to get into, like, say, the intra-abdominal compartment, the more likely they are to get an infection. If they're smokers, the site of the location, so like feet are a place or lower extremities don't heal near as well as upper body. And then compromised patients. And so, as somebody who, maybe has gone through surgery and you have an incision and you want to know if you're at risk for infection, those would be your risk factors. But the other thing to know is timing. Oftentimes when I was doing general surgery, we'd get a call from someone on the floor, like a nurse or a med student, and they say, hey, patient's got a fever, they're one day out from surgery, do they have an infection in their wound? And the answer would be no, because the average time frame for when people get infections is about 4 to 7 days. So you can kind of time that. Now you can get them later. Every once in a while you'll see somebody get an infection a week, 2 weeks later, but it's not that common. Symptoms of that: new pain at the incision site, redness around the incision site, and drainage.
Okay.
Any of those things pop up, you need to let somebody know. And the reason I say that is there are a lot of times the first person to know that they have an infection is either a patient or a family member. And if they don't call their doctor, then that can get out of hand and you can get like a worse problem.
Yeah.
It's always good to catch these things early, whether it be the bread sores or the surgical site infections. So I'm just going to kind of gloss over the other ones because this is kind of getting into the weeds of the rare stuff. Anytime people have a lot of edema, so edema is when you're swollen.
Okay.
Edema is doctor word for swelling. So when people get really edematous, like say the lower extremities because maybe they have issues with their veins or maybe they're more sick and they start to gain fluid, that does put them at risk for wounds. The bottom line on those is just being aware of it and getting those extremities elevated to help get the fluid out and getting some compression on it. And believe me, I walk into patients' rooms all the time and they have this edema and like no one's doing anything. And I'm not, slighting my medical colleagues, but there's a lot of stuff going on. Not everyone thinks about that thing, but as a patient or a family member, if you know that a lot of swelling can cause wounds, then you can be proactive in the care. Talk to the physician, talk to the nurse, say, hey, what are we doing about this? Non-surgical infections, remember we talked about necrotizing fasciitis, which is the one where the tissue dies. Now that's an extreme case of a surgical infection causing a wound, but even smaller wounds that are even lesser infections can cause wounds. So once again, if you think you have an infection, which same symptoms are the same for incision versus just a regular infection, go to your doctor, don't let it get out of hand. Trauma, that's another one. Like elderly patients in hospitals are at risk for falls. I get consults all the time for a patient got up to go to the bathroom, fell, hit their head, now they got a wound on their head.
Gosh.
Yeah, it happens pretty commonly because why? Well, people are tethered to all these IVs. They might be tethered to other machines. They're...
And then whenever you stand up, like after you've been laying down for a while.
Get lightheaded. Yeah, totally.
And you kind of forget like I remember whenever after I had my C-section, I got up and I was like...
Right. Yeah, you're unsteady on your feet. Yeah, totally.
For sure.
So falls can definitely happen in that instance. The last one I want to bring up is medical devices. So the classic one that I think about when I hear about this is either a nasal cannula that's giving oxygen that's too tight or a mask that's giving oxygen that's too tight. Pressure on skin over even a short amount of time, if it's significant, can cause wounds. And I'll get consults for tubes that cause wounds, nasal cannulas, masks, all of that. So if you have a family member that's in the hospital and they have something on them and it's really tight, maybe ask, hey, is that too tight? Do we need to loosen it?
Yeah.
So that's about it as far as wounds go. I mean,
it's a lot of information.
I know. Is it too much? Did I drown you in information?
No, I was just like...
Well, I mean, as I said, I always try to think, okay, why are we talking about this? I mean, maybe people just want to know about it. And some people are interested in wounds, but from my standpoint, it's like, okay, if I can educate somebody on what kind of wounds are out there and what the risk factors are, maybe when their mom or granddad or someone's in the hospital, they'll have in the back of their mind, hey, my granddad hasn't been moving. Is he at risk for getting a bed sore? That'd be a really smart thing to say.
Yeah.
And maybe you could prevent something like that from happening.
Yeah.
Yeah. Education.
Yeah, that's facts.
Facts.